Post-traumatic stress disorder, or PTSD, is a mental condition that is triggered by either witnessing or experiencing a terrifying event. To be diagnosed with PTSD, one must meet the criteria given in the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders. According to the American Psychiatric Association, the following criteria apply to adults, adolescents, and children older than 6 years old. A. Exposure to actual or threatened death, serious injury, or sexual violence in one or more of the following ways: directly experiencing the traumatic event, witnessing in person the events as it occurred to others, learning that traumatic events occurred to a close family member or close friend in cases of actual or threatened death of a family member or friend. The event must have been violent or accidental. Experiencing repeated or extreme exposure to aversive details of the traumatic event. For example, first responders collecting human remains, police officers repeatedly exposed to details of child abuse. B. Presence of one or more of the following intrusion symptoms associated with the traumatic event, beginning after the traumatic events occurred: recurrent, involuntary, and intrusive distressing memories of the traumatic event, recurrent distressing dreams in which the content and or effect of the dream are related to the traumatic event, dissociative reactions or flashbacks in which the individual feels or acts as if the traumatic event were reoccurring, intense or prolonged psychological distress at exposure to internal or external cues that symbolize or resemble an aspect of the traumatic event, marked psychological, physiological reaction to internal or external cues that symbolize or resemble an aspect of the traumatic event. C. Persistent avoidance of stimuli associated with the traumatic event, beginning after the traumatic event occurred, as evidenced by one or both of the following: avoidance of or efforts to avoid distressing memories, thoughts, or feelings about or closely associated with the traumatic event, avoidance of or efforts to avoid external reminders, people, places, conversations, activities, objects, situations that arose distressing memories, thoughts, or feelings about or closely associated with the traumatic event. D. Negative alterations in cognitions and mood associated with the traumatic event, beginning or worsening after the traumatic event, occurred as evidenced by two or more of the following: inability to remember an important aspect of the traumatic event, typically due to dissociative amnesia and not to other factors such as head injury, alcohol, or drugs. Persistent and exaggerated negative beliefs or expectations about oneself, others, or the world. For example, I am bad, no one can be trusted, the world is completely dangerous, my whole nervous system is permanently ruined. Persistent, distorted cognitions about the cause or consequences of traumatic events that lead the individual to blame him or herself or others. Persistent negative emotional state. Example: fear, horror, anger, guilt, or shame. Markedly diminished interest or participation in significant activities. Feelings of detachment or estrangement from others. Persistent inability to experience positive emotions. Example: inability to experience happiness, satisfaction, or loving feelings. E. Marked alterations in arousal and reactivity associated with the traumatic events, beginning or worsening after the traumatic event occurred, as evidenced by two or more of the following: irritable behavior and angry outbursts with little or no provocation, typically expressed as verbal or physical aggression towards people or objects. Reckless or self-destructive behavior, hypervigilance, exaggerated startle response, problems with concentration, sleep disturbance. Duration of the disturbance is more than 1 month. The disturbance causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. The disturbance is not attributable to to physiological effects of substance or another medical condition. Anna is a mixed race and does not know her biological father, as he abandoned her and her mother when she was 7 months pregnant with Anna. She was adopted by her mother's new husband at a year old, and he is the only father she knows. Her adoptive father had a son from a previous marriage named John. Anna lived with her parents, John, and her other 2 siblings from her mother's first marriage. At the age of 5, John started sexually abusing Anna. This went on for 3 years. In relation to this, Anna was also abused by a babysitter's daughter for 6 months at the age of 9. Anna has no memories before the age of 5, before her trauma. At the age of 5 years old, Anna is sexually abused by her brother John. This went on for 3 years. In relation to this, Anna was also abused by her babysitter's daughter for 6 months when she was 9. When Anna was 11, she was surfing the internet and stumbled upon a chat room site where she starts talking to older men. Anna quickly became fond of these sites and spent more time on them. Throughout the first couple weeks, Anna felt loved and needed, and talking to these older men filled the void in her life that she no longer had without being sexual. Eventually, Anna, at age 11, is directed to more sexual sites, such as BDSM, and begins taking orders from people sexually. She essentially becomes an internet prostitute. By the time Anna is 12, she is being controlled/blackmailed by 4 different parties/pimps. When she didn't do exactly what they told her to do, they would threaten to hurt her family, release pictures and videos, and etc. Parents noticed Anna's withdrawal, angry outbursts, and nervous demeanor and questioned her behaviors. Anna successfully comes forward to parents and they seek help as a family. It is important to note that Anna, age 12, has no memories before the age of 5. Latino cultural values play a significant role in the treatment of children affected by trauma and their families. Perez, Valdez, Bordes, and Carrasco, 2008, say that prior research has indicated that social workers working with Hispanic families must become familiar with the cultural values and explore how effective the treatment with the child is over time. When possible, practitioners should incorporate values into their treatment plans in order to provide the most effective and culturally sensitive treatment to these families. Values that often impact the course of treatment include familisimo, the preference for maintaining a close connection to the family. Value of children, the value that Latino families place on children. Parents are often very affectionate with their children. Marianismo encourages Latinos to use the Virgin Mary as a role model of the ideal woman. Thus, Latinas are encouraged to be spiritually strong, morally superior, nurturing, and self-sacrificing. Machismo, a man's responsibility to provide for, protect, and defend his family. Personalissimo encourages the development of warm and friendly relationships. Respeto, the emphasis on the importance of setting clear boundaries and knowing one's place of respect in a hierarchical relationship. Simpatia, the emphasis on the importance of being polite and pleasant even in the face of stress and adversity. Religion and spirituality, the critical role that faith plays in the everyday life of most Latinos. Similar to other ethnic groups, Latinos have a unique set of cultural values that shape their behaviors, thoughts, feelings, and overall worldview. Not surprisingly, when trauma occurs in a Latino family, these values shape their reaction to the trauma, psychological consequences, coping responses, and meaning attributed to the trauma. Perez, Valdez, Bordes, and Carrasco, 2008. Because of this, it is pivotal social workers working with these Hispanic children affected by trauma to become familiar with these values and incorporate these values into treatment to help the families process the traumatic event from their unique worldviews. The strategies important for engaging with 12-year-old Anna and her family are to become familiar with the Hispanic values, conduct a familial assessment, help the family to understand how their Hispanic values shape their perception and response to treatment, assist the family in reframing perceptions of their Hispanic values that may be hindering the traumatic experience, such as familiarism, marianismo, machismo, personalismo, and respeto, and discuss strengths and weaknesses within family dynamics that will affect Anna and the family's treatment. It is important not only to focus on Anna, but also the family dynamic as well. There are many environmental impacts that Anna faces. A major impact on her life is that she has the ability to access the internet wherever she goes. There are many computers within her home, not to mention her cellular device has access to the internet. This is a major trigger for Anna and is a test against her compulsion and self-control. Another factor that greatly impacts Anna is her surroundings. Whether it be her home, where she was initially abused and did the majority of her online work, or the family around her who she feels blame her for John's departure from the house. Anna is reminded of this twice a year when he comes to visit, and she sees just how well the family gets along with him. Although Anna has many factors in her life that may impact her negatively, she has many strengths that will outweigh those. Although Anna's behavior has burnt some bridges in relations with her family, she has an extraordinary amount of familial support. Her parents are willing to do anything and give up anything to help their daughter. Her siblings are open to family counseling so they can learn to love their sister again. Anna is very tenacious and does not give up easily. This will be helpful when treatment gets tough. Anna is also smart enough to realize that she needs to be willing and open to treatment so as to build a better and healthier lifestyle free of risky behaviors, depression, anxiety, and self-loathing. Anna is also able to take accountability for her behaviors and actions that has caused so much grief for her and her family. And last but certainly not least, Anna has the strength to go through treatment and share her story and pain from these traumatic experiences, and that makes her extremely brave. Primary problems. Anna is suffering from PTSD of being molested by 2 different people at a young age, which is contributing to depression and anxiety. Characterized by intrusive thoughts regarding trauma, severe emotional distress, negative feelings about self, emotionally numb, lack of interest of previously enjoyed activities, hopelessness, difficulty maintaining relationships. Her siblings and parents never know what version of Anna they are going to get. She has memory problems, always on guard, easily spooked, angry outbursts, overwhelming guilt and shame, and trouble sleeping. Anna participates in very risky sexual behaviors online. She spends the majority of her time on the internet. She is too anxious to go to school and hardly participates in family events. It is very important to tackle the issue of PTSD to begin with, as this is the underlying problem to everything else going on. Although familial conflict is a secondary problem, it is essential to strengthen the family communication and dynamics to be able to build strong and healthy family relations so Anna can have a strong support system.
To fully understand a person's present state of mind, one has to look to the past to discover any malicious or maladaptive effects that took place in a person's life. Trauma, by definition, is a deeply distressing or disturbing experience that has been imprinted on a person's subconscious. Trauma theory is how an expert interprets these events to understand and find a treatment effective in helping the victim of trauma. According to Bloom, 1999, an individual's mind and body react to a traumatic experience in its own unique way. The traumatic experience impacts the entire person, like the way they think, learn, and remember things. The way they feel about themselves and other people, and the way they make them sense the world are profoundly altered by the traumatic experience. Each year in the United States, approximately 5 million children experience some form of traumatic experience. More than 2 million of these victims are physical and or sexual abuse. Perry, 2003. The aftermath of a traumatic event can lead to devastating consequences in a person's emotional state, cognitive functioning, and social functioning. People that suffer from traumatic events form a dysfunctional state called post-traumatic stress disorder, or PTSD. According to the American Psychiatric Association, since 2013, PTSD can be identified as an anxiety disorder that can develop after a person is exposed to one or more traumatic events, such as major stress, sexual assault, warfare, or other threats to a person's life. As children are developing cognitively, they are soaking up everything around them and learning from people that they come in contact with. When a person has a malicious intent toward the child, those actions can have devastating effects that children carry with them their whole lives. Trauma theory states that psychic trauma occurs when a sudden, unexpected, overwhelming, intense blow or series of blows assaults the person from the outside. Traumatic events are external, but quickly become incorporated in the mind. Terror, 1990. The chances of developing it and how severe it is vary based on things like personality, history of mental health issues, social support, family history, childhood experiences, and current stress levels and nature of traumatic events. At the age of 5, a child's imaginations begin to become more creative. As they increasingly begin to engage in more complex play involving make-believe. John could have lured Anna with promises of a game that would be typical of a brother and sister play. But John's intents were to engage her in a game that was as devious in nature. It's been reported that juvenile sex offenders come from a variety of social and family backgrounds and can either be well-functioning or have multiple problems. A number have experienced a high accumulated burden of adversity, including maltreatment or exposure to violence. Others have not. In some cases, a history of childhood sexual abuse appears to be contributed to later juvenile sex offending. Nambi et al. 2002. John's reasoning for what he did is unknown. His state of mind should have been the question. However, the victim here is Anna. Speculation into John's actions could have been that he was exposed to a traumatic event such as inappropriate images, sexual images, or sexual abuse. Focusing on evidence-based intervention for Anna could have potentially saved her from her actions that took place a few years later. The Substance Abuse Mental Health Services Administration, SAMHSA, has identified 3 trauma treatment principles that evidence-based treatment should embody. First, behavioral health treatment providers must understand the dynamics and impact of the trauma on the children's lives. Secondly, children and their caregivers receiving treatment should be involved in the design, delivery, and evaluation of the services. Third, providers should be culturally sensitive when offering services. Grayson et al. 2012. Evidence-based treatments such as the ones mentioned are generated on the basis of change. Moreover, change in the cognitive function of children like Anna, who have been exposed to traumatic events. The primary goals, according to Chafin, 2004, are that evidence-based treatments are designed to address specific goals. Overt and concrete changes, such as cessation of maltreatment, an improved home environment, and reduction of childhood trauma symptoms are precisely the goals of child welfare. Furthermore, the cognitive state of Anna who has been traumatically affected should be evaluated because children who have experienced trauma may have shown difficulty in sustaining attention, in remembering events, and in thinking clearly when making decisions or trying to plan actions. And this cognitive state was clearly distorted by the traumatic events inflicted on her in her earlier in her life that led to her having PTSD and impulse control. Anna became addicted to those internet sites that eventually led to her manipulation and extortion of the men she came in contact with. Intervention with a specific treatment plan could have helped Anna control her feelings and emotions that comes with trauma-related assaults. According to Grayson, 2012, one treatment for children with PTSD that has considerable research support is trauma-focused cognitive behavioral therapy. TFCBT is supported by studies conducted specifically with abused children and with those who have witnessed domestic violence or who have experienced a traumatic loss. The underlying tenets to this treatment plan are, according to Cohen et al., that it works for children who have experienced any trauma, including multiple traumas, is effective with children with diverse backgrounds, works in as few as 12 treatment sessions, has been successfully used in clinics, schools, homes, residential treatment facilities, and inpatient settings. Works even if there is no parent or caregiver to participate in treatment. Works for children in foster care. Has been used effectively in a variety of languages and countries. In Hispanic culture, there are certain cultural constructs that are touched upon prior in this report. One in particular is Marianismo. Marianismo is associated with in the Hispanic culture with the Virgin Mary, and girls are expected to honor and model her by being pure and remain virgins until marriage. According to Paniagua, several characteristics of this construct include the belief that girls are expected to be submissive, obedient, gentle, and suffer for their families. This can be especially significant in cases of child sexual abuse regarding its view of virginity. It's not uncommon for Hispanic families to view their sexually abused daughters as being impure because they are no longer virgins. If the child is aware of this stigma being placed on her, this may cause them a feeling of guilt for bringing shame to herself and her family. It's important for therapists treating sexual abuse of a victim of a particular culture to understand the stigmas that might relate to that culture. Some cultures have different beliefs that are spiritual in nature and see the victimization as a shame more than a crime.
The following COPES question was formulated to help present the evidence to defend the choice of trauma-focused cognitive behavioral therapy to treat youth with PTSD. If youth from the Hispanic culture suffer from a form of trauma and have PTSD, are given trauma-focused cognitive behavioral therapy as opposed to a different form of therapy, which will result in better outcome for the client. According to Cohen, trauma-focused CBT studies have typically included youth with complex trauma. The following studies specifically focus on these youth. 3 evidence-based treatments were compared to systems of care, or SOC, treatment as usual for youth at risk of disruption due to externalizing behavioral problems. Outcomes were assessed using the child and adolescent needs and strengths and the UCLA PTSD reaction index. So compared to SOC, trauma-focused CBT led to significantly greater improvement in emotional and behavioral problems and PTSD symptoms, and was significantly superior in preventing disruption. The second one, trauma-focused CBT, was provided to 30 youth with complex trauma who were living in a group home. These youth experienced significant improvement in PTSD symptoms from pre to post-treatment, with mean scores on the UCLA PTSD reaction index decreasing from 52 to 21. The next one, 2 studies of youth with complex trauma from sex trafficking in the Democratic Republic of Congo received group trauma-focused CBT. These youth increased positive improvements in multiple trauma domains. According to Walsh, trauma-focused CBT shows results in various environments and cultural backgrounds. Trauma-focused CBT has been implemented in urban, suburban, and rural environments and in clinics, schools, homes, residential treatment facilities, and inpatient settings. Trauma-focused CBT has demonstrated effectiveness with children and families of different cultural backgrounds, including Caucasian, African American, and Hispanic children from all socioeconomic backgrounds. These procedures have been used with adult rape victims with symptoms of PTSD and have been applied to children with problems with excessive fear and anxiety. Trauma-focused CBT integrates several established treatment approaches. Trauma-focused CBT combines elements drawn from cognitive therapy, which aims to change behavior by addressing a person's thoughts or perceptions, particularly those thinking patterns, to create distorted or unhelpful views. Behavioral therapy, which focuses on modifying habitual responses to identified situations or stimuli. Family therapy, which examines patterns of interactions among family members to identify and alleviate problems. Trauma-focused CBT uses well-established cognitive behavioral therapy and stress management procedures originally developed for the treatment of fear, anxiety, and depression in adults. Recognition as evidence-based practice based on systematic reviews of available research and evaluation studies. Several groups of experts and federal agencies have highlighted trauma-focused cognitive behavioral therapy as a model program or promising treatment practice. So it has been proved that trauma-focused CBT in different settings with different ages, different socioeconomic backgrounds, different cultures are better than even the different therapies because it combines so many different things into one. So the ethical dilemma goes back to the Marinissimo, which is where the family thinks that the girls should be virgins, and it is not uncommon for Hispanic families to view their sexually abused daughters as being impure because they're no longer virgins. And then it also is customary for issues to be taken care of within the family and not with outside help. But as we see, the abuse that has happened in the past to Anna is cause for the problems that the family is wanting help with now, because they're wanting their daughter to stop getting on the internet and engaging in inappropriate behavior. But according to the standards for cultural competence in social work practice, standards 1 and 3, it states, ethics and values, social workers shall function in accordance with the values, ethics, and standards of the profession, recognizing how personal and professional values may conflict with or accommodate the needs of diverse clients. And the next one cross-cultural knowledge social workers have and continue to develop socialized knowledge and understanding about the history, traditions, values, family systems, and artistic expressions of major client groups served. So while we want to be sensitive to the Hispanic culture with the family, this girl needs help with her past trauma to help work through and become a healthy individual. So we need to work within the ethics and culture and values of social work practice and get her the help that she needs, and include the family as much as possible so that we are still culturally sensitive for the family. The 2 recommendations for how social workers can engage in practice with Hispanic youth that support and promotes the basic human rights are, first of all, remembering that Hispanics are individuals. Do not generalize research findings or stereotypes to all Hispanics. Treat every Hispanic you meet as an individual and get to know him or her as a person, not just as a member of a particular racial or ethnic group. There will be many similarities and common themes or experiences found in research studies, but it is wrong to assume that things such as liking rice and beans or enjoying salsa is true for all Hispanics. Second of all, remember that Hispanics are people too. They deserve to be treated with respect, dignity, and courtesy. Just because a Hispanic may not know the mainstream language well enough or at all, or they're poor, uninsured, not in this country legally, or from a religion other than your own, Hispanics are still human beings and they deserve to be treated as you would like to be treated if you or a loved one was in need of mental health care.